Welcome to the Prostate Health Channel, where we talk about everything men need to know about prostate health, bladder health, and overall well-being, with clarity, honesty, and evidence-based advice. If this is your first time here, we're really glad you've joined us. You're in the right place if you're looking to take better care of your health, especially as you get older. Now let's get into today's topic. Is sitting down to urinate actually better for men than standing? It's something that most people never think twice about. For many, it's just a habit formed in childhood. Boys are taught to stand, and that's that. But recent research and medical insights suggest that there might actually be health benefits to choosing to sit. So today, we'll explore the science, the reasons behind both options, the cultural differences, and why it might be time for some men, especially older men, to rethink how they urinate. Let's start with some eye-opening statistics. A global data analytics firm surveyed over 7,000 men from 13 countries and asked them how they usually urinate. In the United States, only 10% of men said they always sit when peeing. Around 31% said they never sit, and 17% said they rarely do. Interestingly, these percentages didn't vary much between younger and older men. Now compare that to Germany, where 40% of men said they always sit, the highest sitting rate among all the countries surveyed. And the percentage of men sitting increased significantly with age. So culturally, there's clearly a difference, but is one approach better from a health standpoint? To answer that, we need to understand what physically happens when you urinate, whether sitting or standing. When you sit, your pelvic floor muscles tend to relax more naturally, allowing your bladder and urethra to function more efficiently. When you stand, however, your body engages some of those pelvic floor muscles to help with posture and balance. This activation can make it more difficult for the pelvic floor to relax completely, which is necessary for urine to flow freely. Now, in many men, particularly those under chronic stress or dealing with anxiety, the pelvic floor can become overly tight or tense, a condition sometimes called high-tone pelvic floor dysfunction. This can lead to a range of urinary symptoms, including difficulty starting urination, a weak or interrupted stream, the feeling of not fully emptying the bladder, pain or discomfort during urination, increased urgency or frequency. It's a condition that's often overlooked in men. Some people carry their stress in their jaws, they grind their teeth, get headaches. Others carry it in their lower back or shoulders. But many carry it in the pelvis, often without realizing it. And this can lead to a cycle of discomfort that affects not just urination, but even sexual function and quality of life. In these cases, sitting to urinate can reduce muscle tension and allow for a more complete and comfortable emptying of the bladder. But the conversation doesn't stop there. Let's talk about one of the most common health issues facing men as they age: benign prostatic hyperplasia, BPH, or enlarged prostate. This is a non-cancerous condition where the prostate grows in size and starts to press against the urethra. It's extremely common. By age 50, half of men have some level of BPH. By age 80, that number jumps to around 80%. An enlarged prostate can create a bottleneck for urine flow. Imagine trying to drink a thick milkshake through a narrow straw. It's slow, frustrating, and you have to put in extra effort. That's exactly what happens when urine tries to pass through a urethra squeezed by an enlarged prostate. Common symptoms of BPH include hesitation or delay when starting to urinate, weak or slow urinary stream, intermittent flow, dribbling after urination, the feeling of incomplete emptying, waking up several times during the night to urinate. Now here's where sitting comes into play. One study looked at men with BPH and compared their urination patterns when sitting versus standing. The results were clear. Men who sat down had a faster urine flow, emptied more urine, and had less post-void residual, meaning they left less urine in the bladder after urinating. This suggests that sitting may actually improve bladder emptying in men with enlarged prostates. Not only does this feel better and more complete, but it also helps reduce the risk of complications like urinary tract infections, bladder stones, and overflow incontinence. So what about men who don't have BPH or any symptoms? Is there any reason for them to sit? Another study, done in the US, asked men about their urination habits and preferences. Of those who preferred to sit, many said it was simply more comfortable, especially at night or after long days. Others mentioned physical limitations, like arthritis, back pain, or recent surgeries, which made sitting easier. Interestingly, some men said they chose to sit because they were already experiencing some symptoms and found it easier to manage their strain while seated. Others chose to sit out of consideration for hygiene, wanting to avoid splashing or missing the toilet, which, let's be honest, happens more than many care to admit. However, some men feel strongly about standing. For them, it feels more normal or masculine. And that's completely okay too, as long as you're not experiencing symptoms or discomfort. Standing is not harmful. There are even men who say they use their phones or read while sitting on the toilet. Now, a quick word of caution here: spending too much time on the toilet, especially while distracted, can lead to hemorrhoids and other rectal issues. So if you do sit to urinate, don't turn it into a reading session. Let's bring this all together. Here's the bottom line. If you're under 50, healthy, and have no urinary problems, you're probably fine standing. But if you're over 50, dealing with symptoms like a weak stream, dribbling, or incomplete emptying, or if you've been diagnosed with BPH, then sitting might actually help you feel better and urinate more efficiently. And even if you're symptom-free, there's no shame in sitting down to urinate if it's more comfortable or cleaner for you. What's most important is doing what's best for your health, not what society expects. If you found this information valuable, please take a second to like this video, subscribe to the Prostate Health Channel, and share this content with someone you care about. These small actions help us reach more men who need honest, science-based health advice. And before you go, be sure to check out our next video on urinary dribbling. It's another common issue that most men don't talk about, but one that can be managed with the right knowledge and support. Thank you again for watching. And remember, take care of your body, take care of your health, and take care of yourself, because you are worth it.